Hi, I'm James. I'm one of the GPs and clinical director of Pathfields Medical Group, an expanding practice covering 31,000 patients in the centre of Plymouth. Our patients have a diverse range of needs, from those that are socially very deprived to many older people living in care homes. We are really excited about general practice and the career opportunities, and we are keen to recruit new doctors, nurse practitioners, paramedics, and also, maybe, a geriatrician in conjunction with our acute and community providers. At Pathfields we have an awesome multidisciplinary team, including advanced nurse practitioners specialised in paediatric work and seeing most of the kids on the day when required. We have advanced nurse practitioners seeing many of our other patients from all walks of life. We have 2 paramedics who manage the home visiting service and vastly reduce GP visit workload. We have an extensive prescribing team led by a pharmacist, as well as some pharmacy technicians and some administrators that massively reduce the amount of repeat prescribing that comes GP's way. They're also very keen on helping us reduce our patients who are taking opiates onto safer levels of these drugs. We have a workflow team that manage most of our letters, and from previously seeing maybe 50 letters a day, it's now down to maybe 3 or 4, which is a huge improvement on where we were 5 years ago.
At Pathfields, we work with a diverse patient group with significant healthcare need. Our organisation is completely designed around the needs of our community, and we are passionate about delivering the greatest care for all of our patients. We cover 31,000 patients in our practice, and at this scale, it means we've got the headspace to deliver services that go above and beyond traditional general practice. This is a snapshot of what we do and what we're really proud of.
At Pathfields we have a complex lives service. This is something that we're really passionate about. We help some of the patients that are the most needy in society with deprivation, those who are survivors of abuse, those who are on multiple drugs and are having a really rough time of things. We do this through integrated mental health and primary care, where we work very closely with the mental health service. We help them with prescribing and deprescribing and avoidance of harmful drugs such as the opiates and benzos and gabapentinoids. And we help them get some therapy to move forwards with their lives in a positive way rather than becoming dependent on healthcare. We've reduced referrals to secondary care as a result and helped a number of patients. In so doing, we have helped change some of our heart-sink patients into our heroes, because when you understand their life story, you really understand what they need. We want our patients to lead long, happy and healthy lives, and to do this we help them by ensuring excellence in population health management, ensuring diabetes is treated to target, that they get their blood pressures checked and followed up and treated to target. We're really impressed by the work we do in this regard, and we always get 99 to 100% in QOF, and we're particularly proud of our diabetes achievement this year. Nationally, in the past 1 to 2 years, performance in HbA1c achievement has flatlined or dropped nationally. We are bucking the trend with our HbA1c achievement going up by 4% this year, and we've also diagnosed many more people this year early in the course of the disease and boosted our prevalence by 10%. By doing things like this and using data and technology, we are able to deliver truly excellent care to our patients and also bring system benefit by reducing admissions to the trust.
For older people, we like to support them to lead happy, healthy and independent lives for as long as possible in a dwelling of their own choosing. To enable us to do this, we are fully integrated with our community provider, and we deliver shared assessments using an MDT on a shared IT solution. The output of that is a care plan which is shared with all the other providers in our locality. In addition to all of this, we work with our acute trust, where we've got a designated receiving ward where patients from our primary care network are, if they are admitted, they're preferentially admitted to this ward, and we support discharge planning with them as well. Lastly, we are a training practice and have multiple trainers and a training program director that enables us to train a combination of medical students, foundation year 2 doctors and GP VTS trainees. We also support international recruitment and retainer programs that help GPs back to work. We're most proud of this service, and we actually are one of the few practices that have a waiting list to take patients on, to take GP trainees on.
We managed to do all this great work as an organisation because we have a superb group of colleagues and partners. It's through trust in each other that we're allowed to go and experiment and try new things that generally work for the benefit of our patients. I guess the next thing to do is to introduce you to our wonderful colleagues.
Oh, that's a good one. Oh. Yeah. Okay, I'm feeling the love.
So these are my colleagues, a great bunch of people, hugely supportive of each other. They're great doctors and brilliant to work with. If you're seeing this from outside of Devon and are thinking of moving down, I should probably sell Devon a bit, although it doesn't actually take much selling. It's a great place to live with some very affordable but high quality housing and lots of good schools locally, and also there is so much outside activity with the moors and many beautiful beaches, all just a few minutes drive away. It really is a lovely place to live and bring up a family. For me, one of the key things is that sense of community. Back when I used to live in London, I didn't really know my neighbours and it all felt quite isolated. Here, I know so many of my neighbours and we regularly go out for walks on the moor with our friends. And we all remember what it was like first leaving the VTS scheme to a world of general practice. Certainly for those of us who've only just left the training scheme within the last 4 or 5 years, we remember how daunting it can be. That sudden switch to 10-minute appointments of seeing increasingly complex patients. At Pathfields, we think that the 10-minute appointment is fairly dead. We no longer see those coughs and colds that are simple, we see the more complex and challenging cases as GPs. Therefore, our rota works out with lots of breaks and catch-up slots so that our average appointment length is 15 minutes for all GPs. For those just starting out, we would anticipate maybe longer appointments or more catch-up slots. Everyone at Pathfields has had a young family at some point. We all know how stressful it is if you're running late but you have to get home to pick the kids up from the school bus or from the school gates. In fact, I can think of few things more stressful. Therefore, we're very happy to job plan around school pick-up times and drop-off times to ensure that you have none of that stress associated with picking your kids up. We want you to come to work, be happy, and know you're going to get off on time.
Whatever it is, whether you need extra support from the practice and extra time given back to you to develop an at-scale change service, or you just need a guarantee of being able to get off work in time to be able to pick up your kids, we can totally co-design something for you and develop the right job plan for where you are in your life.